Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello, my name is Hazel Dockery. This is Practice Plan's podcast, and with me today is Fiona Ellwood, who's the Chief Executive of the Society of British Dental Nurses. Now, thank you for joining us, Fiona. It's very good to have you here. You've been doing a lot of work recently to do with inappropriate behaviour. It's something that started, I think, with surgeons. Is that correct?
Yeah, no, absolutely.
And what you've said that there are some new findings. When we had a chat earlier, you said there's some new findings. But can you give me an idea of what the extent of the problem is?
It's very, very early days to give a full extent of what the whole problem is, but incredibly, I cannot believe the responses that we've had from all of the professional groups. So initially, you'll know perhaps that we set out looking at dental nurses, really through a comment from the surgeons who quite flippantly, or perhaps not flippantly, but off the cuff said, if this is happening to us, what on earth is happening to the nurses?
Yeah.
So we made a point of looking into what's happening with dental nurses, knowing that in the past we are very familiar with some of the cases that we've seen come through, and we know through being dental nurses ourselves how challenging it can be at times. And there are some things that perhaps when I started I can share with that. I look back now and think, oh, was that really appropriate?
Yeah.
But the findings so far have come, as I say, they were originally from nurses. We were then asked if we would open it up across the whole team. And you think things have gone. You think that behaviour has disappeared, or perhaps not, I don't know. But we've been really stunned at what's come forward. So it's anything from sort of commentary, what they call banter, the whistling, the innuendos, commentary about clothes, commentary about hair, bodily appearances, the way people sit, the way people walk. Some of the most distressing are around touching, around power games, around promises of promotions or training places, and so on and so forth. Some have even come to some of the older things around being made to sit on people's laps and things. Now, they're not common,
Right.
I must emphasise that. But some of those behaviours have come through, and you just think, maybe we're naive to what goes on, and we don't offer that space, that opportunity for people to speak up and speak out in a safe place. But the other thing that I recently went to an event, and it really got me thinking even further, was students.
Yes.
And particularly the dental nursing students. Perhaps it's happening in the others and we need to explore that. That'll be a next phase.
Right.
But where they're really worried, they've got their first job, they're under pressure to perform, they need to get sign-off on things. And again, it's not all, it was a few that responded, so we must be really careful not to tar all with the same brush. But you do wonder, where this is going. And in the commentary that we've had so far, this is not just male and female, this is female and male, this is same sex, this is patients as well as team members, not just dentists, it's other team members. So we mustn't get misguided now thinking, if you like to think, that it's always males, that it's always dentists, because this is not what's coming through. It's across the profession. It's quite often with intimidation and bullying and harassment, all the other things. But I think a lot of the publicity always seems to focus on males, and I think we've got to be really careful to steer away from that, or at least be open-minded that it's a broad brush. It's not isolated. You can look, we have done, just out of interest, we haven't done a great deal of scrutiny at some of past cases on the General Dental Council hearings. We know things go on. Unfortunately, we originally set out with the sexual misconduct titles.
Yes.
And we didn't get a great deal of response, and we were recommended to change the title to unwanted behaviour in the workplace. Then they came in. So it's almost that fear of branding that. But the other interesting thing that we found out actually is that the unwanted or inappropriate behaviour at work stems right from the very minor things, if we dare call anything minor, to what people would deem to be quite major. People actually don't understand what is classed as inappropriate behaviour at work. So we miss so much. They only think it's worth raising a concern about what most people would consider to be quite severe, if you like, most intimidating. So we have also, as the Society of Dental Nurses, have written a piece just outlining what actually is inappropriate behaviour, so that people can start to understand when it's perhaps right to start raising a concern, so that it could perhaps be nipped in the bud and that it doesn't escalate into other things.
Yeah.
That's the worrying thing, because we quite often find that small things can escalate, and people who get into a difficult situation will say, gosh, I can see the path looking back.
Yeah.
But if they felt able to speak in general terms at the small things, we will never know, but could that have prevented some of those problems?
But I suppose defining inappropriate behaviour helps in that, as you say, some people may not recognise it as being inappropriate, and because it's part of maybe a culture within a practice or something like that, it's deemed acceptable, and that they would be stepping out of line to raise it as a complaint. But also, I suppose perpetrators as well might not recognise their own behaviour as being inappropriate.
Very true. There is an element of, and I've just traced it back the papers now, so I haven't got a really defined answer, but whether a wolf whistle even is determined as inappropriate. And again, you're right, it touches on the recipient and their perception and how it's made them feel. We know we've got the protected characteristics, which we know they're safe. But on the presentation, and I'm sure you saw that when you previously spoke to me, we talked about what is lawfully unacceptable and what is socially unacceptable, and of course culturally unacceptable as well in such a diverse world. So it is that lack of perhaps understanding. But if I take you back to when I qualified, which is quite some time ago, I appreciate that, but that was the time when dental nurses in particular were still wearing dresses.
Yeah.
We had to wear white dresses. And I really don't mind sharing with the commentary that really makes me sort of think, ooh, right now, because in some people's eyes it might be nothing. But when I look back at it, I think that really wasn't appropriate. So we were made to wear dresses, and I was trained in the hospital. And when we came out, I went into general practice, and we were told that we had to sit with our legs open, and that our if it was a right-handed dentist, that our left leg had to be locked on the inside of the dentist's leg, and that was our stability, so that when we leant forward to work in the patient's mouth, because we've got a small confined area, that was the right thing to do.
That's shocking.
Well, it is, isn't it? And I remember thinking, I don't think I can do this, because I was very quiet and quite reserved and hadn't really thought that situation through. It never crossed my mind that somebody would even say that to me, let alone expect that of me. But of course, in the era that I qualified, I mention this now as I've started to look into this, and everybody's saying to me, yeah, it's true. We all used to do that.
Oh my goodness.
So it's this thing about normalising, isn't it? And that shouldn't have been normalised ever.
No.
It really shouldn't have been. And I guess if it happened now, I don't think it would be accepted. And I guess over time, how have we become more aware? Do we feel more able to speak up? Or has it just been really outlined of what is not appropriate? I mean, thank goodness that our uniforms changed, and the vast majority of dental nurses now will be wearing scrubs or trouser uniforms. I mean, of course, wearing the white dresses and everything else added to other problems, especially in a feminised profession. But the reality is that to be told as a newly qualified or fairly young and naive dental nurse that you need to sit with your legs open and lock into the inside of that dentist's leg now makes me think, ugh. And I didn't say anything at that 18-year-old, and I don't know.
But that's a question of confidence as well, isn't it? And I think, just sort of reflecting on what you said earlier about it, power games, it's almost like a casting couch sometimes, isn't it? You said about you were concerned about students, it's like the old-fashioned casting couch in movies, in that, certain favours could be traded for other things. And that's a complete abuse of power. And it must still be going on from what you've said from your responses, which is quite shocking. But where do we go from here then?
It's really interesting, isn't it? So the surgeon's work has unveiled far more than ours has so far, whether it's a lack of confidence or whether it's the environment, because it's quite enclosed and there's the power dynamics there is perhaps even stronger. I don't know. I am in touch with them talking about that. I find the whole thing quite bizarre. We are still getting responses and wider. We've also spoken to the General Dental Council. I sat in a webinar recently which was looking at the extent of student issues and the abuse that goes on, and there's been some really challenges in universities when people are away from home as well. So there's all that to consider. Where do we go from here? So really interestingly, the GMC have actually incorporated within their standards about not undertaking or misusing or misguiding sexual innuendos and sexual behaviour. It's actually stipulated in their new guidance. Right. And as the GDC are looking to reconsider some of their literature, we have approached them as part of the Dental Professional Alliance and asked them to consider that wording, because the inference isn't enough anymore.
Yeah.
The inference isn't enough. We need to say it. It needs to be there so it's accountable and it's measurable. So the whole team, and I think we need to talk about it not being appropriate. The trouble is that sometimes if things are difficult to talk about, it's easier not to talk about them.
Yes.
So I think in education, in CPD, in lectures, in literature, the norm must be that it's okay to talk about it.
Yeah.
And we need everybody, every professional group, every trade group, anybody that comes into contact with this, we need to do it. We also need to call it out. The big thing that my campaign in all of this is not to be a bystander.
Yeah.
Because if you recall in some of my literature on the presentation, there was something like 86 episodes of different levels had been seen. Only 16% of bystanders, and they were reported.
Yes, I remember.
So 16% against a ratio of 80/6 is an awful lot going.
Yeah.
And you could be that one person that stops that cycle of perpetual behaviour that people put up with.
But again, we've got fear there as well, haven't we? Because we're talking about someone potentially risking their own job to stand up. So you're asking a lot, really, aren't you?
Yeah, it is. And that's why it comes back, I think, to a lot of having allies.
Yeah.
Developing those in practices and workplaces, whatever that institution looks like. There's a whole area of psychological safety, which we need to be better at, which is feeling safe to go to work, safe to have conversations, safe to question, safe to challenge. We've really got to be better at getting all these things into place. And I think that that's absolutely huge. And we always talk about putting the patient first and the patient's interest first and the patient's safety first. But there has to be some insight into the challenges that the profession faces itself. And I have a slightly different mantra from a human factors work, and that is around the team need to be safe. The team need to feel safe. They need to be armed and equipped to work well. And they need to be able to work to the best of their capacity in order that patients are safer. So, this is chicken and egg conversation. But I think that stems actually from the GDCR. They're really predominantly to protect the patient. So we need that allyship and that guardianship of the team. We need that to evolve, and we need it to evolve quickly.
Yeah. Thank you. Thank you very much for spending your time with us. It's great.